The identifying factor for impingement versus other types of shoulder pain is what we call a painful arc. So if I have a hard time lifting my arm, not from here to here, but it starts to hurt from here up through here, that's a very, very suspicious for an impingement of the shoulder. My name is Jason McHugh. I am board certified in family practice and osteopathic manipulation. I also have a certificate of added qualification from the American Board of Osteopathic Family Physicians. I practice at Western Branch Family Practice. In general, there are two very broad categories of shoulder pain, either happening after an injury or slowly progressive. Impingement is what we're speaking to now, and that happens slowly over time. That rotator cuff muscle is pinched between the bones of the shoulder and not given time to heal. It then functions improperly. Because the shoulder is so complex and because the stability of the shoulder itself is from muscles rather than bone, any small issue can become a long-term problem. And that is reflected in the patients that I see in that they are from all walks of life and essentially all ages. Typical treatment for this condition would include at least a start with home exercises. The next step would then be a referral to physical therapy for between 4 and 8 weeks, depending on the severity of the condition. If that has failed, or if the patient desires a more quick return, you can inject the shoulder, which will provide benefits as far as increasing motion and decreasing pain so that physical therapy can be more effective. With my duties as the medical director for Secours in Motion, I have a very frequent contact with physical therapists and orthopedic surgeons, which benefits me in that if I have a patient of mine that's in physical therapy and is not responding the way they should be, or a therapist has a question about that patient, it is very easy to get on the phone and find out what the story is with that individual to benefit them as quickly as possible. Shoulder impingement can be a chronic problem that is off and on, but once it's been evaluated and treated correctly, as long as the individual that's experiencing it does the work to maintain the function of the rotator cuff, they can go on to have perfectly functional lives without any limitations whatsoever.